So in this video, we're going to go over some of the nerves of the thoracic limb. And here we're looking at the medial aspect of an equine thoracic limb. My hand is holding onto the area of the brachial plexus, and you can see a couple very large nerves leaving the brachial plexus right here. The first one I want to mention is this nerve right here, which is actually the musculocutaneous nerve. Then here we have the combined ulnar and median nerves. Here we have the radial nerve. We have a thoracodorsal nerve. The thoracodorsal nerve will be traveling directly over here towards our latissimus dorsi. Now let's come back to our musculocutaneous nerve. We see this nerve is actually wrapping around this axillary artery right here. That wrapping of the musculocutaneous and joining in with the median and ulnar, that right there is the ansa axillaris, or axillary loop. It's usually directly from the axillary loop that we will see the cranial pectoral muscle, the cranial pectoral nerve leaving to innervate portions of the superficial pectoral, aka the descending and transverse pectoral. So this is the cranial pectoral nerve. Again, innervating the superficial pectoral muscles. These nerves we see here are actually going into the deep or ascending pectoral. Those would be caudal pectoral nerves. And usually the caudal pectoral nerves will also be leaving a nerve that will be traveling along the ventral aspect of the latissimus dorsi, and that would be traveling back towards the cutaneous trunci muscle. That is the lateral thoracic nerve. So let's come back up here just for a second. Again, we have this radial nerve that we see coming down, and the radial nerve is going to be diving through these muscles. Let's pull out a different specimen here. Again, looking at the medial aspect, a few things have been cleaned up here so it's a little easier to visualize. We now see the median and combined musculocutaneous nerve right here. We see this nerve diving from medial towards the lateral side through the triceps muscles. That is going to be the radial nerve. We see this nerve traveling down towards the medial aspect of the elbow. That is the ulnar nerve. We have this nerve diving down between the subscapularis muscle and the teres major muscle. That's the axillary nerve. Let's go over some of the branches of these nerves real quick. Again, right here we have the combined median and musculocutaneous nerve. Leaving that is going to be the proximal muscular branch of the musculocutaneous, which is diving through the coracobrachialis to travel over here towards the biceps brachii. So proximal muscular branch of the musculocutaneous. Down here we have our musculocutaneous nerve leaving our median nerve. So now we have musculocutaneous nerve and median nerve. If we follow the musculocutaneous nerve, we can see that again on this specimen right here. We have our musculocutaneous nerve. If we reflect that biceps brachii muscle right there, maybe, deep underneath here is where you're going to see the musculocutaneous nerve split into this nerve right here, which is the medial cutaneous antebrachial nerve. And that nerve is the one that's going to be coming out here right alongside the lacertus fibrosus. That's within this fascia here that hasn't been cleaned up. But there's a nerve right here that's coming around the lacertus fibrosus. That's your medial cutaneous antebrachial nerve. The other branch that you see right here, diving down towards the brachialis muscle, is the distal muscular branch of the musculocutaneous. So it's not until the musculocutaneous nerve dives underneath the biceps brachii that you get the split of the medial cutaneous antebrachial and the distal muscular branch of the musculocutaneous. So let's come back up here. Again, we see the branching of your musculocutaneous from our median nerve. Here's our median nerve traveling distally down the thoracic limb. We see some muscular branches coming off to innervate some of the heads of the deep digital flexor muscle. The median nerve continues down here until it separates into a medial palmar nerve and a lateral palmar nerve. Here we're looking at the median nerve traveling distally down the limb. And it's at this point that we can see the median nerve split into this nerve that's staying on the medial aspect, that being the medial palmar nerve, and this branch that's splitting, coming laterally and actually joining up right here with a branch of the ulnar nerve. So if we look up here, we see the ulnar nerve descending down the caudal aspect of the antebrachium, and it's back here that it splits into a branch right here. Let's see if I can turn it. Again, our ulnar nerve is coming down. It's splitting into this branch that is going to come through this tendon and come out here to the dorsal aspect. That's the dorsal branch of the ulnar nerve. And then we have this branch that we see is actually joining up with our lateral palmar nerve. This branch of the ulnar is the palmar branch of the ulnar nerve. The palmar branch of the ulnar nerve joins up with that lateral palmar nerve and then will continue down the lateral aspect as the lateral palmar nerve. Unfortunately, our little communicating branch got a little hacked here, but this little branch between the medial palmar and lateral palmar nerves would be the communicating branch. Our medial palmar nerve will give rise to our medial palmar digital nerve, and our lateral palmar nerve will give rise to our lateral palmar digital nerve. The other structure that we should see coming off of these is going to be coming off of our lateral palmar nerve, and we can see, if we get this artery out of the way, we can see another nerve coming off of our lateral palmar nerve, going deep to these tendons, and that is what's actually going to give off our medial and lateral palmar metacarpal nerves. So here we see again that deep branch of the lateral palmar nerve coming deep under here and would give rise to the nerves traveling with these arteries with the same name, being the medial and lateral palmar nerves, palmar metacarpal nerves. Okay, so we talked a little bit about the ulnar. Let's come back up here. So again, we're looking proximally now at the ulnar nerve, and the ulnar nerve is going to be giving off a nerve usually up here, kind of in the brachium, that's going to come to the caudal side of the antebrachium, that being the caudal cutaneous antebrachial nerve. The ulnar continues around the medial aspect of the elbow and descends down the caudal side of the leg. And here again we can see the split from where we have our dorsal branch that's going to come through here, and that's actually this nerve we see right here. This is our dorsal branch of our ulnar nerve coming between these two tendons. And then we will also see our palmar branch right here. In this specimen, our palmar branch has been cut away from our lateral palmar nerve right here. But if we look really close, we can see this palmar branch of the ulnar meeting up with that lateral palmar nerve and continuing distally as the lateral palmar nerve. There again is the deep branch from the lateral palmar nerve that's diving down and giving off palmar metacarpal nerves 2 and 3, aka medial and lateral palmar metacarpal nerves.